Hi, welcome to Rope In Mental Health. I'm Garrett Kennedy, mental health consultant. Today I want to talk about buy-in. Buy-in is a term that we use in the safety industry to describe the mental acceptance of a workforce, the emotional investment of a workforce in starting or engaging in a new policy or procedure. So if there's a new piece of equipment or a new product that comes online, we have to go through our safety spiel and figure out what all the dangers are, teach the information, and the correct or best practice way of actually conducting business with that new piece of equipment. It's all part of the package, but we need buy-in from the workers that this process is going to lead to a benefit. Now, where mental resiliency training comes in with this is addressing the actual motivation of people. Understanding the core drive of most people is not money, is not gratuities, it's not, well, I guess that is money, isn't it? But it's not perks or bonuses or anything like that. There is an intrinsic emotional need that needs to be filled, and that's where everybody's drive actually comes from. So in the mental health world, we have all of these ways of adjusting behaviors, and we implement them in the educational sector, in addictions control, in developmental disabilities, treatment and support. It's a very broad spectrum that is addressed through through creating motivation or changing the motivation of an emotional event. So when somebody feels stressed out or they're coming up to that new task that they've never done before, when they're coming up into a crowd or a job interview for the first time after being homeless for a long time, there's a lot of emotions that need to be kept in check, but they have to recognize that doing this new procedure, whether it's part of your business or part of your life, is going to ultimately end in a benefit for you or your family, wherever your ultimate motivator lies. Now, an ultimate motivator is a term that some programs I've worked with have used to describe what is that urge that causes a child to push over another child, or whatever the behavior is that you're trying to stop. We look at it from a very medical model of treatment. And we look at, there's a diagnosis, there's a certain way that the brain works under these certain circumstances and conditions that are created by the environment, the social network, the personal skills of the individual, and then we try to find a way that somebody can live their life as happily as possible with these diagnoses. Now, the problem with buy-in in occupational health and safety is that's all well and good, and that's all very technical means of deep-rooted therapies, but how does that relate to buy-in at a workplace? Well, buy-in at a workplace is based off the same emotional principles. There is a buy-in to new safety protocol. For example, new mental health procedures. Let's say your company is trying to start and you need worker investment in that. You need that emotional connection that these new changes that you're going to suggest are going to lead to a better environment, a happier, more positive workplace where people see each other and interact with one another and actually understand or observe what's going on around them in an interactive way that just makes the whole place, of course I'm going to say more resilient because I'm working on that backwards, right? But anyway, the resiliency of the whole place is going to be improved with these new policies that are brought in. You will just enjoy not only your job, but your life quality better. This is what we're trying to convince people of when you're starting any new policy, whether it's because you need to increase the gains of the company, or whether you need to push out product faster or with higher quality, maybe a little bit slower. Whatever your focus is, to improve your business, you have to address change. You have to address the ability to adapt to change. And the definition of resiliency is simply the ability to thrive in adversity, or the ability to cope with adversity, and change. So when I'm looking for mental resiliency, I'm looking for a movement across a number of different industries where we're looking at mental health proactively. And once we learn how to actually implement these very simple skills into just the daily routines of what goes on in your business anyway, but you do it with a little bit more mindfulness, as we say, or a little bit more observant of what's going on. Who doesn't want a staff that's a little bit more observant to the details of what's actually going on? Now, part of that is understanding the emotional side of things, and this is where most people start to get a little hesitant and lost. But these are not complicated items. We're talking about problem-solving skills. You can go find any number of courses on collaborative problem-solving. You can also address social and networking and social network and interpersonal skills. Many different courses available out there through Canada, and a lot of them are covered by provincial healthcare plans and whatnot. But what I'm focusing on primarily is the emotional regulation and the emotional sensitivity of an issue. Now, that is what brings mental health into play. Because when you're talking about buy-in or worker buy-in to a new policy, you're actually talking about changing their motivators. You're talking about giving them a new emotional investment. So guiding that and leading that, you're going to find more success with mental skills rather than physical skills. It's not the physical skills don't affect bringing in a new policy. That would be silly. But what we're addressing at buy-in level is a cognitive concept. There is no physical piece of buy-in that you could actually shape. You have to step into the realm of emotional language. And once you do step into that realm of emotional language, which is a lot easier and a lot less scary than most people think, but once you find the words to describe how you feel, you'll find that workplace problem solving goes a lot smoother. When you actually understand that somebody's having a bad day and that bad day is going to affect their productivity, you can step into the emotional realm of whatever's causing their bad day and guide through the process as co-worker, colleague, supervisor, whatever works for your company. Once these very simple skills are taught or are learned, they're transferable. And the great thing about transferable skills is that they, by nature, are usually fairly simple. You can have one worker teach another worker, teach another worker. So once a core group of individuals can understand the basic principles of guiding the emotional motivation or buy-in of new policy, then you're going to find that these people can teach those skills to others and so on and so forth, and it creates that web. It actually uses the social networking web already existing in your workplace. So buy-in has a number of different barriers to it. Some of these barriers are internal, but they're all mind-type mental skills. They're all mind-type mental conditions, such as negative thoughts. When you bring in a new policy or procedure, inevitably, there may not be 100% of the people doing the work that believe the new process is better. So when you're addressing the mental concept of which is better, which is going to make this person's day better or the productivity of the company better, and how that actually is a benefit for that one employee who's kind of the holdout or is just causing a lot of water cooler talk. Because the social network is all based around those water cooler talks, those hallway meetings, if you will. When you're walking down the street and you talk to another individual in your community, you are communicating knowledge along that network pathway, that string of communication, that rope, that line, that cord that actually connects us all is that knowledge sharing. And when you're talking buy-in barriers at the workplace, if you have one person who's just got a tone about them that makes the other staff believe, oh, that one over there who's been working here for 30 years, they don't really think this is going to work. You know, that subconscious message gets sent almost uncontrollably sometimes. So buy-in becomes not only an intrinsic mental or an internal mental skill of guiding one's own buy-in, guiding the buy-in of other people, but it's a cultural skill. It's a cultural health issue that everybody be working towards the same goal. Because ultimately, hope that you're going to succeed is tied into all working towards that same goal. If you don't, then success is defined differently by different people. Success to some might be to keep the old system the same. Success by others might be defined as bringing in new policy. Well, working out the language, the emotional language in between there, which is causing the feelings of hold back, the feelings of no buy-in, is a kind of a complicated issue. This is why I don't generally advise the term buy-in. What I like to use is rope in. Because when you're buying in, or when you're asking somebody to buy into a new policy or procedure, ultimately you're asking them to give something up, to purchase, to buy, to give something up of their own self or beliefs, and embrace this new wonderful thing that is effectively the new shiny new car, but the new policy. When you're roping somebody in, when you're bringing them into the fold, when you're explaining to them the knowledge that you have and using this social network, when you're addressing the mental and emotional language and aspect of a person, you're not really asking them to buy in. You're giving them all the information they need, and then respectfully letting them decide whether they want to come into the fold and be roped in, or whether they want to not. And you're going to have to deal with that somehow. Through these skills of emotional regulation and emotional sensitivity, you don't have to have that complicated language. What you need to do is go out and find some way of changing just the language of the healthcare model to the language of occupational health or of your workplace. It's what we do. It's what the safety community is all about, is building that language. So I do see a bit of a barrier to buy-in being buy-in itself. I don't think we necessarily need to focus on buy-in. What we do need to focus on is building the mental ability to cope with adversity and change. And when we actually address that as a mental skill, we're not asking somebody to give up any part of themselves and come along with the plan. They're part of that network that creates the plan, and they're already roped in before whether or not to question it even becomes an issue. To truly have a roped-in mental health wellness program, you would have to be creating that resilient, observant, positive environment that just embraces change and realizes that this is leading us all to a better place. So I'm asking you to consider looking around your local areas and finding some resiliency training. Find some mental resiliency training programs, and you want to be looking for the 5 basic skills of problem solving, of emotional regulation and emotional sensitivity. That's my specialty. Also social networking, interpersonal skills, and you also want to be looking at the overall community. So be a little open to sharing what works in your mental health program with people in competing but relevant industries. Safety is that knowledge, that rope that binds one small community to another small community, and we can better share information through the occupational health and safety network that already exists. And I'm asking you guys to go out and take a look at some places that can take these very simple mental skills of resiliency, psychological skills of recovery, the colors of regulation, whatever you want to call them, whatever works for your workplace is what you need. So find a guide, find somebody that can actually help you translate these very simple skills to your workplace's language. Now, one place you can go to for this, if you want the PowerPoint experience, is usually your provincial health networks and whatnot have access to maybe some nurses or nursing students who can come in and give you some, really basic information on this if you want the medical side of things. But what you're really looking for is an expert of some form who can help you implement this in real time. Because worker buy-in will not just affect mental health. Being able to cope with worker buy-in and rope people in to new programs and changing the whole wording of the way we deal with this as a community at whole will enable us to rope more people in to a positive line of thinking, which, by the way, I will define anyway in another video, that whole thought of positivity. And what does that really mean? To me, in short, it's just working towards a common goal. That's positive movement. That's positive. Okay. So I think we've done enough of the mental health awareness campaign. I think we've done enough of letting people know that workplace stress really is a hazard that is damaging workers and their families. Okay. Like it's in the laws. Go ahead and look them up in your province. But normally there is a specific section that actually defines mental or psychological health as part of the responsibility of an occupational health plan, because there is occupational health that is affected through the mental hazards of your workplace, right? An easy example of this is the stress at the end of the day, workplace stress. Everybody has it. That is another word for a mental hazard. Workplace mental health stress. Workplace mental stress is basically the same thing as saying a mental health hazard. Think about that for a minute. So we need, as an industry, to get together and actually agree that using this information network that we've created to rope more people in to addressing mental health directly as a wellness issue is actionable. We can move from the awareness campaign to an action. Addressing buy-in is a good place to start the conversation about how these skills can be implemented and help. Worker buy-in can be aided through mental resiliency training. And changing that language to more of a roping in, to more of an embracing of new people into what works. Anyway, thank you very much for listening. I'm hoping that together we can create a resilient, observant, positive environment for us all. I know that you'll keep me on your files there, or keep looking for me every once in a while. I'm switching up my format to going to once a week. I'm going to be doing a bit of a Mental Wellness Wednesday tip. So I hope you liked my first one on worker buy-in. I'm starting to work out the wording of some of these concepts. But let's start a conversation. Let's get the wording specific to your workplace. Let's make sure you personally and your team are creating that resilient, observant, positive environment. And I wish you all a great day. Remember to do something fun.